All right. Good morning, everyone. Welcome. We'll begin in just a few moments as we let everyone coming in have a chance to connect to their audio. All right. Good morning, everyone. Welcome to today's San Francisco Interfaith Council's weekly online briefing for faith leaders. Today, we have an interactive COVID-19 vaccine confidence training. This session will be hosted by the San Francisco Interfaith Council and supported by the Joint Information Center of the San Francisco COVID Command Center. Some housekeeping for today. Audio, video, and chat will be monitored and recorded for record keeping, training, and quality assurance. By default, all participants will be muted and video turned off to minimize the distractions. To submit a question or comment, select the chat button at the bottom of your screen. Get tested, San Francisco. You can save lives and stop the spread of COVID-19 by getting tested through your healthcare provider. If you don't have health insurance or can't get tested through your provider, visit sf.gov/gettestedsf or call 311 for information on getting tested at a city-run testing location. A safe and effective COVID-19 vaccine, coupled with continued preventative measures, are our best tools to end the COVID-19 pandemic and safely reopen San Francisco. Go to sf.gov/COVID vaccine for information on eligibility, vaccination sites, including locations, and links to book appointments if available. Now is the time to come together, San Francisco. We've been through so much in the last year. Together, we can stop Asian discrimination, bias, hate, and violence. The COVID-19 virus has no race or nationality. It is simply a disease. To report a hate crime, please contact the San Francisco Police Department at 415-553-1133. And a special note that the San Francisco Interfaith Council is a sponsor of this program. And now at this time, I'd like to hand the floor over to the Executive Director of the San Francisco Interfaith Council, Michael Pappas. Michael, the floor is yours.
Thank you so very much, Elisa. And it's hard to believe that this is our 51st program. And we are so grateful to the COVID Command Center's Joint Information Center Virtual Outreach Team for providing not only the staff, but the platform so that we can impart this very important information which allows our faith leaders and the leaders of our religious institutions throughout San Francisco to make informed decisions on behalf of those who have been entrusted to their care. Good morning, I'm Michael Pappas, and on behalf of the San Francisco Interfaith Council, I want to welcome you to this week's online briefing for faith leaders. As of May 16th, 2021, 76% of eligible San Franciscans, 16 and over, received at least one dose of the COVID vaccine, with 61% of that population having been fully vaccinated. That leaves 1/4 of the city's population unprotected from the virus, and with them, all children 12 and under who are not yet eligible to receive the vaccine. Faith leaders, health professionals, and community organizers are now being called upon to help reach out to the unvaccinated, one-on-one if necessary, and talk with them about their choices, share meaningful and real information, and help dispel rumors and misinformation that could affect and deter people from making informed decisions. This week's online briefing for faith leaders, hosted by the San Francisco Interfaith Council and supported by the COVID Command Center's Joint Information Center Virtual Outreach Team, will feature an interactive COVID-19 vaccine confidence training designed to help congregation leaders gain confidence in vaccine choices and offer effective ways to convey this critical messaging to their congregants. Without further ado, I I would welcome and invite the chairman of the board of the San Francisco Interfaith Council, my friend and colleague, and also the executive director of the Shanti Project, Kaushik Roy, to offer a welcome on behalf of the board and read the Interfaith Statement.
Thank you so much, Michael. Good morning, everyone. My name is Kaushik, and on behalf of our board of directors, it is my pleasure to welcome all of you who are joining us this morning. Thank you for being here. Before we got on live, we were chatting and just talking about, even from a few months ago, how different life feels here in the Bay Area. And in particular, one of the examples of that for us is some of the programs and city efforts that had to get started, that started in response to the epidemic, are now winding down and coming to a close because they're no longer needed. And I think we are all continuing to have cautious optimism, but the optimism is now a little more underscored. And that is very exciting for all of us, I'm sure. At the same time, I just want to say one thing about the pandemic, and I know Sister Sukanya is here as well. The case of what's happening here in the Bay Area, unfortunately, of course, is not being duplicated in other parts of the world. And in particular, I'm thinking of India, where my parents immigrated from, and who we are talking to extended family and friends and folks who have been impacted by COVID right now. And it is a very heartbreaking situation. And I know there's other places in the world as well, of course, for sure. So I hope as we continue to, knock on wood, get back to having what we were used to before 14 months ago as a way of life, we never lose sight of how far away so many other folks are in the world from getting there. I also want to just give a special welcome to all of the folks who may be joining us for the first time. I hope this will not be your last time joining us. I hope you will return. We rarely talk about this, but the end of the fiscal year is coming for a lot of nonprofits. And so I would just remind all of us that the Interfaith Council is a small private 501c3 nonprofit. For obvious reasons, we do not accept any funding from the government. We do believe in the separation of church and state, unlike some of our politicians. And because of that, really our efforts are based on the generosity of the gifts of time and donations financially that everyone gives. And I share all that to say the larger our group and our audience can be, the more powerful and effective the interfaith community can be, and the greater example we can be for others in the city and beyond the city. So not only for all of you to continue returning and supporting us, which we appreciate, but please embrace the role of ambassadors as well, and let the folks in your lives who do believe in interfaith community and harmony know about us, and encourage them and invite them to be a part of our family as well. And then lastly, I always want to be sure to thank our dynamic duo. We only have 2 staff members, so if you are on our email list or you can sing all the things we have been doing over the last 14 months, take a moment and appreciate how busy Michael and Cynthia Zamboukas' lives have been since the pandemic started. So to Michael and Cynthia, as always, I cannot say this enough, but not just from the board, but the entire community, interfaith community in San Francisco as a whole, is really indebted to the 2 of you for everything you've been doing, and I know will continue to do. So thank you. As Michael mentioned at the beginning of every Interfaith Council meeting or gathering, there is an interfaith statement we'd like to read. It's just a nice way to take a moment and remind ourselves why we are gathered together in the first place. This is an interfaith community. Whatever our individual belief, it can be freely expressed here with no apologies. If we are invited to offer a prayer in this setting, we are free to do so. It should be offered according to the tradition with which we identify. If we are invited to speak on a subject from the perspective of our tradition, we are free to do so without fear of offending those who come from another tradition. We come together as people of faith to learn from each other that we might better understand the multiplicity of faith traditions in our city and in our world. Good morning, everyone.
Thank you, Kaushik. And those of us in the nonprofit world know that especially when you have a small staff, the leadership of the board of directors is critical if we're going to make serious advancements. A lot was said in the waiting room this morning, and I reminded Kaushik that of some wisdom that he gave me at the outset of the pandemic. He said, Michael, this is a marathon and it's not a sprint. Well, we've been sprinting through it, and Kaushik's been sprinting with us through it. And I just want to say a special thank you for the commitment he's made, not only to his work as board chair, but also to this program. As I mentioned, this is our 51st program, and he has been with us virtually through almost all of these programs, offering his support, his wisdom, and his kind words. So thank you, Kaushik. It is a real joy for me to welcome Sister Sukanya Balsari from the Brahma Kumaris Meditation Center. Sister Sukanya is a past board member. Her wisdom, her kindness, her beautiful soul continues to touch us and enrich our interfaith fabric. I've asked Sister Sukanya to offer this reflective moment and any other words that you would like to share, Sister.
Thank you, Michael, and the member of the boards, Brother Kaushik, and every one of you who have been part of the organizing committee and also participants. We all form a very enriching group for the city, a very inspiring community for everyone to follow. Good morning, everyone. We say good morning because we still have the opportunity throughout the day to make it better and to make it even the best. So let us take the opportunity, the gift that is given to us every day, the time, the 24 hours we have, to make it better and best for ourselves and for everyone. So let us take this reflective time for the self and for the larger community. Wherever you are seated, I invite you to sit very, very comfortably. Let us relax into this moment. Let us know that there is Almighty above and beyond the entire story that keeps going on. Let us invoke the Almighty, that supreme light, that supreme being, into this gathering. Let us feel the participation of the Almighty, along with all of us, the guiding light, the light that keeps us alive and shining. That supreme light, that Almighty, the mother and father of each and every one of us, our supreme teacher, our supreme guide, our supreme leader. Let us allow in this moment a space for the supreme light to be in our hearts, to be in this gathering. Under the parenthood of the One Supreme, all of us, souls, the inner lights that we are in these various costumes of the bodies. The soul is the child of the Supreme. Let us connect our hearts with our dearest brothers and sisters, the shining spiritual lights that we all are individually. We are the supreme children of the supreme parent, of one parent, a global family. In this moment of silence, let us spread the good wishes of our hearts to each and every one, to every corner of the world. And let us send our purest thought to our dearest brothers and sisters who are truly in need at this moment. Oh, dearest brothers and sisters, we are with you. Let us collectively, let us in this gathering send this thought out to our family, global family. Oh, dearest brothers and sisters, we are here for you. Whatever you need, we are here to support you physically, spiritually. Any help you need, we are here as children of the same supreme parent that you are. Let us hold the world, this universe, in our divine and loving embrace. I embrace the humanity with my heart and soul. Visualize each one of us holding our hands together, circling the globe, circling the human family. This energy, pure energy that is being generated right now with our pure thoughts, pure heart, is strengthening each one of us. It is strengthening every brother and sister on this earth in need, especially related to this disease that has been spread. The families that have been left behind as souls have left their bodies suffering from the disease. We all are here together for the world. Let us send our prayer, our meditation, our pure and powerful silence and love to the souls that have passed away, the light of the Almighty, the ocean of love, the ocean of mercy and power is shining on those souls. The supreme light of love is shining on their families. And shining upon each one of us. as we slowly come back into this awareness of this gathering, this wonderful gathering, let us be aware throughout that there is one more participant in this gathering that won't be shown in the count of participants. And that one, that invisible, powerful force, participation, is of the Supreme, the Almighty, the ocean of love, ocean of mercy. Let us welcome the Almighty into this gathering. Thank you. Om Shanti. Om, I am Shanti, peace, benevolence, harmony. And just as I am, so are you. You are peace, benevolence, and harmony. Let us bring this onto this earth, into this world, into this gathering. Om Shanti. Thank you.
Om Shanti, Sister Sukanya. And most especially, thank you for reminding us that we are part of a human family and a global family. And until these vaccines reach far, this pandemic will not be over. And so we share in your prayers and we send our love. Thank you. Sisters and brothers, today is going to be a little bit of a different format than we're used to. We have opened up the chat today. In the past, we have not, out of consideration for our presenters and the limited time we have, and as to minimize distraction. But today you are not passive spectators, but you're active participants. We are doing a training today, not a presentation. And with that, I welcome John McKnight, who is the Community Engagement and Virtual Outreach Unit Lead for the Joint Information Section of San Francisco's COVID Command Center, as well as Hafisa Salabai, who is the Community Group's Hub Co-Coordinator for the San Francisco COVID Command Center. When we were in the waiting room, I laughed a little bit because John and Hafisa have been behind the scenes and producing every one of these programs along with Elisa and Sharon. And today they're going to be your presenters. This program is very significant because until we get everyone vaccinated, the pandemic will not be under control. And so today you have permission and encouragement to use the chat actively, to ask your questions, to make your points as John and Hafisa make their presentation. They have tirelessly, indefatigably gone throughout San Francisco and have sent the message that you're going to receive today. And it is my hope and prayer that the information that they convey to you, you will convey to your congregants and those under your spiritual care. John and Hafisa, it's a joy to have you. The floor is yours.
Good morning, everyone, and thank you, Michael, for the warm welcome. So John and I will be presenting here today on how to build COVID-19 vaccine confidence. We will train you in helping people make informed choices about the vaccine. This training will help you make conversations with people of your community who may be uncertain about the vaccine. Maybe they heard something that made them worried about it, or they have prior health conditions. Whatever their uncertainty is, we recognize that it's very important that people receive information from people they trust, and that's you. So everything we present here today, we will share with you. You may use all or part of it to help you in your conversations. Before we jump right in, we would like to hear from you in the chat. Please share your name, organization, and what are your community's biggest concerns about the vaccines. We encourage you to enter your questions in the chat with the hope to address them during the training. But if there will be time during the end for Q&A as well. Right, so here's the agenda for today. We will provide a COVID-19 vaccine overview, followed by the side effects and what happens after getting the vaccines. We will then lean into a discussion about vaccine experiences and mistrust. We will also have time for question and answers, and we will also share some resources and tools that you can take along with you. So when talking to communities you serve, reminders such as we are here to provide information so that we can make the best decision for yourself is the approach you want to make sure you take. This makes it comforting for them, and it also provides support and acknowledgement. Ultimately, it's an individual's choice to get vaccinated. So when speaking to someone, create a safe space for them to voice their trauma. We aren't there to prove them wrong, but there to listen. Ask them to share what they know about the vaccine, and then ask for permission to share vaccine information and facts. If they give you permission, offer a response based on fact and your personal experience. As I mentioned, you want to focus on facts rather than correcting false information. If you must address the false information, always emphasize the core facts, not the false information itself. And what's really helped us when speaking to others is sharing our personal experiences, because those are the most powerful. Who knows, they may be experiencing something similar. In this way, they will be able to connect with what you are saying. At this time, I'm going to go ahead and hand it over to John to give us a brief COVID-19 overview.
Thank you, Havisa. So let's have a quick overview of what COVID is. As we all know, this is an airborne virus. It's transmitted by particles that people breathe out, particularly it floats on the moisture particles. It comes out of our breath. It is a highly infectious disease. It transmits from one person to the other, and it transmits typically when people are asymptomatic. The great challenge with this disease is a person can remain asymptomatic, showing no symptoms, and yet still spread the disease. The common symptoms once you feel the disease is fever, cough, shortness of breath. The good news is this is preventable. It's preventable by maintaining a safe social distance, remaining masked, and being conscious that if you are in large crowds to take extra care. Let's talk quickly about the vaccines. I want to make sure that you have some information to share with people about them. So first, a couple of points. Vaccines are free. There's no insurance needed. If anybody tells a member of your congregation they need to provide information or they need to pay for that, tell them to go somewhere else, and we want to hear about that. Vaccines are for everybody. There'll be no questions about documentation status asked, and information collected at the vaccine sites cannot be shared with ICE. There are 3 safe and effective vaccines here in the United States, and we're very fortunate that way. All 3 have been tested rigorously with multiple ages and ethnic groups. About 27,000 people were done in the adult studies and a little over 2,000, almost 3,000 in the youth studies that were just completed. There are youth studies, by the way, going on for kids under 12. Those are expected to come out towards the end of next year. The 2 main vaccines we hear a lot about are the Pfizer Moderna. These are what we call messenger mRNA vaccines. We'll speak about that in a minute. And the Johnson & Johnson. The Pfizer Moderna are 2 doses. Johnson & Johnson is 1 dose. And what you want to keep in mind is that millions of people across the nation have already received them. We've seen probably the full spectrum of effects that can happen as response to receiving the vaccines. Pfizer Moderna are given with a small period between the 2 shots to stimulate your immune system. Pfizer is given with a 3-week period between the first and second shot, and the Moderna 4 weeks apart. If you miss that window and go a little longer, it'll be just fine. How much longer, we don't know, but if worst case, you may have to take an extra shot, is what we've heard, but those are people that have waited months in between. Fully vaccinated status, that's you having received your full regimen, plus 2 weeks. So for Pfizer Moderna, that's your 2 shots. For Johnson & Johnson, that would be 1. I want to talk about messenger RNA vaccines, but whatever it is, this is your body is learning to recognize COVID should it ever be subjected to it. So what is mRNA? Messenger RNA is something your body produces naturally. It produces it every day. Every cell in your body produces it. It's simply a set of instructions to make something. Your body, think of your DNA as the full cookbook or instruction book to make everything that you are. When it needs to make something like an eyelash, a blood vessel, what it does is it produces a little mRNA in the cell that tells the body to make something. Your body, once it's made it, breaks down that mRNA and gets rid of it. This is one of the reasons why we think mRNA vaccines can be very helpful, because first of all, it uses the body's own mechanisms to make up what the vaccine, to make up what the body needs to recognize, but it also is easily cleared out because it's a natural part of your body. So what is it that you're teaching your body to do? The mRNA vaccines from Pfizer Moderna are producing a single, what's called spike protein. This is sort of the Velcro on the outside of your COVID-19. It is not infectious, but that little spike protein, once your body learns to recognize it, and your immune system is triggered to respond to it, should you ever get COVID or be responded to it, your body will instantly recognize it and be able to clear it out of your body. So the mRNA vaccine teaches your body to make something that your then immune system responds to, and it teaches your body to recognize it should you ever get infected with it. The Johnson & Johnson vaccine is just a little different. It is a DNA vaccine, so it adds an extra step. Instead of giving your body the messenger RNA to make the spike protein, it uses DNA, which needs to go into your cell nucleus. And then the body's own mechanisms again makes the mRNA, which in turn turns into the spike protein. So it simply adds a step. It does have to use a different delivery mechanism. It uses an inactivated cold virus, or adenovirus is what it's referred to. And this extra step has been used in other vaccines across the world. We do know about the very rare blood clot issues. I don't want to belittle them. If you have a choice between your vaccines, why not take the one you know is even safer than the others? But keep in mind, the Johnson & Johnson side effects are 1 in 1 million. And by any drug effects, this is very, very safe. Even aspirin has side effects. So consider this when you're taking your vaccines. And if you're really concerned, talk to a doctor or talk to somebody who we can get you set up with to have better information. Something that comes up in all of our conversations. The concern is that these vaccines were made in a rush, and the good news is these vaccines were based upon years of research. It was about 10 years ago, a little more, that we saw the rise of MERS, Middle Eastern Respiratory Syndrome, and SARS, which you probably heard about. MERS killed 500,000 people worldwide, but did not spread across the world the way this other did. It did not become a pandemic. But because these were coronaviruses, and because they were such a concern at the time, certain research teams started looking at ways to create vaccines to these coronaviruses. You see Professor James McClellan and his lab associates, including Dr. Wang and Niansheng. It's actually Dr. Wang's work that is the fundamental basis of everything we're receiving. They did this work 10 years ago. Their work was shelved. No one thought anything of it. They couldn't even get published. Nobody thought that a coronavirus would be the next big pandemic. And when it came out, and the National Institute of Health realized that this was a coronavirus, they called these people basically out of retirement. Their research immediately became the forefront of national discussion, combined with the work of Dr. Drew Weissman's lab and the work of Caitlin Carrico, who basically invented the mRNA vaccine concept. And then Dr. Kazmika Corbett here, who working with the National Institute of Health, brought this together, formed the vaccine in what seemed to be record time. But what you want to know is this is based on over a decade of hard research by people who no one would have known their names had it not been for this. But the people on here, this is the reason we have a vaccine today and not 3 years from now. The hard work they did are saving all our lives. With that, I want to hand it back to Havisa.
Thank you, John. All right, so we'll now cover some details on COVID-19 vaccine distribution. So given the state and federal government are driving the vaccine allocation, the San Francisco Department of Public Health will be there as a safety net for those who do not have insurance. Currently, supply is still our biggest challenge, and everything is being done at local level, yet the guidance for distribution of the vaccines are being controlled by the federal and state level. The San Francisco Department of Health does not decide who gets vaccinated first. However, they are responsible for allocating and administering a portion of the vaccines delivered to San Francisco. And with this comes many operational challenges, such as where to store and who to give access to. All right, so let's briefly talk about the side effects and what happens after the vaccine. So, a lot of people get side effects. Some may not. You may feel immune. You may feel your immune system respond after getting the vaccine. All symptoms are short term. On the arm, where you do get vaccinated, you may encounter some pain, redness, or swelling. I myself just had a little bit of swelling and soreness. And throughout the rest of your body, you may get fever, chills, headache, tiredness, joint and body aches. If you get mild side effects, you can take ibuprofen or Tylenol after the vaccine, only if you do not have medical reasons that prevent you from taking these medications. To reduce pain and discomfort, where you do get vaccinated, apply a clean, cool, wet washcloth over the area, and then make sure you exercise your arm. I didn't do it the first time around, but when I did when I got my second dose, I made sure I exercised my arms, so that really eased up the soreness, and it wasn't sore for that long after that. But please note that these are just suggestions for mild side effects. If you are experiencing side effects that are of your more concern, we do recommend that you get medical assistance. So when you're building vaccine confidence in the community, acknowledge the impact that COVID has had on the community. The reality is that we've been in this for over a year, and it has had a huge effect on all of our lives. Spend time listening to those who are uncertain about getting the vaccine and engage them in conversations about what factors and thoughts led them to where they are at now. When counseling on making decisions, you'll have to take an approach that fits their way of thinking. So you're going to have to take an approach to not only think about the vaccine on its own, but you'll help them weigh their options. What is the COVID-19 risk, like the fears and concerns, compared to the side effects of the vaccine? So let's talk about the risk of COVID first. The simple truth is COVID is severe and deadly. Over 500,000 people have died in the US alone and are still dying. But thankfully, vaccines are helping in reducing the death rates. And as you may have heard, India is one of the hardest hit countries during the pandemic. I have family friends who were pretty much fit and healthy, but once they were exposed to COVID, they were gone within 2 or 3 days, where they're no longer with us. So as you can see, the disease is very severe and deadly. But then if you look at the side effects of the vaccines, they're far less severe than the disease itself. As we mentioned, there are many people that have been vaccinated and have had no symptoms or just very mild symptoms. But for those who do have side effects, it may not even last for more than 24 hours. I myself probably just had side effects for like 6 hours, and that was about it. I know others that got vaccinated, got very sick after it, had like fever, chills, headache, started getting toothaches and joint pains. But then they thought, what would have happened if I had been exposed to COVID? How would have my body reacted to that? So as a reminder, help the people you are talking to weigh their options, compare the vaccine risk and COVID risk, and acknowledge their concerns about the side effects. But then also remind them of the severity of the disease. So at this time, I'm going to go ahead and hand it over to John, and we're going to go ahead and lead into a discussion. If you could please submit your questions in the chat, it would be greatly appreciated. We'll go ahead and address those. But before that, John, if you just quickly.
Thank you, Havisa. I want to read you these 4 points. This comes from a past CDC director, Dr. Tom Friedman, who wrote this during the pandemic. Some considerations. If you get infected by the virus, it will go through your entire body, and it'll stay there for at least a week, and it's much more likely to cause you long-term problems than the vaccine. If you get the vaccine, it will prepare your immune system to fight COVID if you get exposed to it. The sooner we get vaccinated, the sooner we can get back to work, reopen our business, essential services, and this includes our houses of worship and all that you do to serve the communities. And lastly, if we all get vaccinated, well, here in the United States, we as a nation can save more than 160,000 lives that we believe we will otherwise lose to COVID. I think that last number hangs on there. We're talking about watching what's happening in India, South Africa, other countries that have not been able to get the vaccines out to the people. It's a solid reminder of what this virus can do. This is not the flu. The way it attacks organs is intense. And I think one of the questions that will come up often is, what about the long-term effects of the vaccine? And I know that the challenge with that question, Sister Sakenya brought this up, is the only way I can talk about a long-term effect is to have that vaccine be in people for a long time. You're absolutely right. We won't know for a long time. The indications are amazingly good. The wonderful podcast with Dr. Kuzmika, she's literally in tears. Someone who's worked in this industry for her whole professional career has never seen safety data like this. We're all hoping, we are all praying that that data holds up and we don't find a kink in the armor. But what we do know is that young people are being affected by this. And though most people don't get very sick, some of them are having lifetime organ damage at a young age. Elders are passing, people are losing grandparents, and we're losing family members of all kinds of ages. And it's so random. This is one of the things that's come up a lot, the randomness of the disease, how one person who you'd think would get seriously ill walks away from it and another person does not. The only way we're going to stop this is to vaccinate the population and prevent the spread. The more it remains in our community, the longer we're all going to be living with it. But let's go into this. I see a couple of questions, and Sister, your comment, the vaccine has not been tested enough to know its long-term side effects on the body. That's the real trick, the long-term effect. Will there be long-term effects from this? I think what one has to ask is, what's the cost if you don't get vaccinated? What is the potential cost of seeing this virus? Who could you bring it home to? The question for me was answered because I personally, I wasn't feeling scared of the virus so much, but I was terrified that I'd bring it home to my wife. And that's what kept me up at night. Michael, please.
Not unrelated, John. I'm just hoping that you might be able to allay any confusion. Dr. Fauci and the CDC came out with this proclamation a week ago saying that, those who are vaccinated don't need to wear masks. And then shortly after that, California said, we're going to put on the brakes for a little bit and wait till June 15th. Can you speak to that dissonance there, but also its relationship to vaccines? Because I think that there is a direct relationship.
Certainly. The challenge what keeps up every health professional in the country are two things. This first is that we're going to get a variant that's going to break out. Because the virus is spreading wildly in many communities, even here in the United States, because it's growing wildly, there's a chance it's going to change, as it is changing often, but it's going to change into something that will not be affected by the vaccines anymore. That's what keeps people up at night, that we will have to step back, that we will need to then take measures to prevent the spread of this into communities that the vaccine will no longer affect it. Because of this awareness, and that we in California are in a densely populated state, we have some of those densely populated cities in the country, certainly on the West Coast, we know that we need to continue to maintain some safety measures. Simply taking off the masks right now would open the door too wide. I believe that the reason we're seeing the governor and other health officials maintain the care is because, well, it's the good news. The very good news is, with the vaccination rates we're seeing and the care we've been taking, our numbers of COVID in the community continue to drop. I want to say this morning in our daily outbreak, our daily report, we saw again, no one died yesterday from COVID in San Francisco. There was a time not that long ago, we saw days where 22 people would die in the city a day. And that just strikes me. How could we lose so many people in a day when we know the cost of this? We're down to 0. I think we've only lost one person this week. I'm looking at Visa. That's wonderful. There's still 12 people in the hospital, possibly fighting for their lives today. And we see that number as well. And that's a reminder that this is still a very real issue. The reason we're staying masked is we want to continue to see those numbers drop. We're going to continue to be masked because children under 12 cannot be vaccinated yet. And we don't want them to either feel like they're different, and also ensure that we continue to protect them. But we want to make sure that our progress towards reopening continues, that we don't lose ground because of a relaxed state that we can live with. I would rather be masked than lose the opportunity to attend my church.
You've got a couple of good questions here from Diane Lawrence and Mary Wardell. I'll let you tackle them.
I see from Diane, can you address vaccinations for COVID survivors? Should they get vaccinated? What type of side effects can they anticipate? Oh, that's a fun one. I'm going to pass that to Havisa.
So Diane, I'll admit that I've had COVID. I've had very mild symptoms. I want to say I actually didn't have any symptoms at all. If I want to say for my second dose, the first time around I got it, it was I wasn't prepared. I was just kind of like, hey, there's vaccine available if you want to go get it. So I wasn't really prepared for it. So I wasn't very hydrated, and I think that may be the reason why I did have my side effects. And that was just getting the chills and a headache. The second dose came around. I made sure I was hydrated, drank lots of orange juice, ate well before getting vaccinated, and I had no side effects at all during the second one. It was interesting. One of my cousins went to get vaccinated at one of the high volume vaccine sites in a different county, and they were told that if you get a reaction to the first dose, and that means you've had COVID. And if you don't get a reaction, and if you get a reaction to the second dose, that means you've hadn't had COVID, which clearly don't think that's true. Obviously, my husband got vaccinated last weekend. He also had COVID, and he did not have any reaction at all. So there's a lot been going on in the community. I mean, the people are sharing misinformation around, but ultimately, everyone's body reacts differently. My mom had COVID as well. She had a fever and chills, but I had more milder symptoms than her. So again, everyone's body does react differently.
Hafisa, can I follow up on that?
Sure.
Because
Yeah.
my son and half the lacrosse team at the University of Arizona got the COVID early on, and so he had the antibodies. Is it important to get the vaccine if you've gone through it and have the antibodies? Can you address that question?
I think so. I think it is. We don't know how long the antibodies are in our bodies. Again, if consult with your doctor if you have any concerns. But I do recommend that if you haven't been hospitalized due to COVID, I do recommend getting vaccinated just to get the extra protection as well.
John, you want to take on Mary's question?
I will take on Mary's question. Thank you, Mary, for that one. And I want to stop here for just that half second. The reason I wanted to hand that one to Havisa, besides the fact she's great at presenting on this, is when you're talking with people, speak from your experience. I can talk the science. I'm a molecular biologist by training. I could do a much deeper dive into this. At most people, that may not work for them. Maybe they would need to hear from a doctor. Maybe they need to hear from you, their pastor. But if you get stuck where you don't know how to answer a question, because there are questions I can't answer. Mary, thank you for this curveball. This is a great one. I can address a concern, but I can't tell someone they're wrong. I can't tell them they're misinformed. But what I can do is I can talk about my experience, why I did something. And if you use that approach when talking to people, it can go a long ways because perhaps you're somebody they can relate to. So with that said, let me go into Mary's question, which is, she is commenting on, I've heard on several occasions different people of faith talk about their faith in God as a reason not to get vaccinated, the idea that God will protect me. And she goes on along this means, I believe in God, and I believe that God has given us many gifts. The people that I presented to you, those people who dedicated their lives to science, to doing extraordinarily hard work, I believe they're a gift from God. We were blessed, not lucky, blessed to have them had done the work in advance to get us ready. So when this virus did hit our communities, we were able to create a safe vaccine. May there be long-term side effects? I really hope not. But I know what COVID can do. I've seen what it does, and I don't want to see our hospitals filled the way they were. I don't want to see our nurses and doctors at risk. I want to see children grow up with their families and grandparents. And this is where that balancing act comes in. Do I think God does not want us to take advantage of the resources he put in, the brilliant people in our lives? I believe that those people are there for a reason. That would be the answer I would offer to that question. Sister, you ask if people will get vaccinated every year. That is a really good question. We don't know yet. The question, is the same thing about the titers of antibodies. How long will they last? This is on the question. It's also with the new variants coming out. If some of them get to push a little further out, we may need to have like a flu shot, an annual shot that maybe stimulates your body to other forms of COVID, but we don't know yet. We don't know. What is my guess that we will? I think so. I'll bet you'll have some kind of booster shots on a periodic basis like you do with other diseases that we've eradicated. And people, I think we've often forgotten about what vaccines mean to our lives. If you're a Rotary member, you know that you're fighting polio. And if you were a little older than me, the next generation up, you might even remember the hospitals with people in iron lung wards as effective polio, or the typical crippled look of the polio person. You might even remember smallpox or some other horrors that used to be here. They're gone because of the work that science and people have done, communities have done to eradicate these diseases from our world. COVID is one of these. We're going to knock it out. And we are grateful that we have such smart people working on this every day.
John, I wanted to mention, I looked at the participants online today, and a lot of familiar faces, 9 of our board members. I know they're not shy, and I guess, you know, if they've been at all hesitant, or they know people who are hesitant, it would be interesting for them to share why people are hesitant and to see if that's valid. You mentioned something in the waiting room, because I said, you know, here we are in San Francisco, and I'm going to be careful how I say this, but, you know, we consider ourselves enlightened and progressive. And I questioned you as to whether we are not getting vaccinated for the same reason people elsewhere are not getting vaccinated. You began to answer the question, and then we had to get into the logistics of the day. I'm wondering if you could take that on.
When we look at sometimes what a person says and what they're feeling may not be aligned. What I hear, even across the nation, are a lot of common resistances to taking in new information, to change. I think a lot of our reasons to not get vaccinated are stemming from a very similar place. Now, this is with a lot of cultural sensitivity. There's been misuse in the medical field of vaccines, of other information, inequitable sharing. There's a lot of very valid mistrust. And that is something that at best I can recognize. And by seeing it best, I can't speak to it because it hasn't happened to me. But this is why we are training you. I can speak to many things, but I don't necessarily have the trust of your community. We're sharing with you some tools to talk to people so that you can talk to your community. Because what a person says, maybe the reason they don't get the vaccine may not really be the core. Maybe it is mistrust. Maybe it's fear. Maybe it's the resistance to change, what they've heard on the news. And if you sit and talk to people long enough, more particularly if you listen to them, I think you'll get to the eventual root cause. And I think that's the trick. Just sit with people that are struggling. See what you can do to listen to them. And maybe somewhere, believe and I have faith, as I've seen this in many disaster responses, if you sit with someone long enough, you'll find out the real reason behind their thinking. And that's when maybe you can, from your own experience, address some hope that this vaccine will change our lives and give us some opportunity to return to lives where we can all be together.
Thank you. And Jessica Sterling, thank you for your comment there, because I think it's a compliment to our presenters. John and Hafisa, I just remember sitting and watching the glee, if you will, when the CDC came out with their speaking about masks, and I watched it carefully because it sounded as if maybe perhaps it was a reward that people who got vaccinated didn't have to wear their mask. I'm hoping that it's not a punishment to those who have not. But do you foresee a double standard, if you will, in terms of receiving services and ability to function in society down the pike here for those who have been vaccinated and those who have not?
Michael, this is becoming, I think, half of our day is talking to you about this. But let me address our houses of worship and people that work with this. The question that I'm starting to really begin to bring up is for us all to think about what June 15th looks like. That's the magic day we keep hearing about where California will reopen. It sounds like many of the restrictions will be lifted. How do we choose to live at that point, knowing that our children remain unvaccinated, that perhaps 20% of the population have not vaccinated or are unable to vaccinate, that virus is still in our community? We want to open our houses of worship. We want to be able to go back to business. We want to get sure that people have jobs, because we know, so many of you know, the security that's essential by people having jobs. I don't need to talk about it, but all of you working in the nonprofits know that when there's no work, we see a lot more need. We need to consider how we are going to live as communities. So, Michael, it's not so much whether or not one can or cannot be, or whether our services are not going to be there. I think we have to decide how we're going to live, I think from a moral standpoint, to ensure that our communities everybody can get back to work, that everybody can get back to their church, that everybody has an opportunity to walk safely in the community. And I got to tell you, being unmasked widely seems to be a challenge to that. Many of our houses of worship are thinking about whether or not they'll have vaccinated or unvaccinated sections, whether or not they'll be permitting people to come in who are unmasked, or not really say they will be necessitating that indoors of houses of worship people will remain masked. These are good questions to start talking with your congregation leadership, to think about what that future looks like, and I look forward to hearing your thoughts.
I will tell you, community leaders and healthcare professionals were invited to a special performance at the San Francisco Symphony. And in order to get in, we needed to show our vaccine card or proof that we'd been had a negative test. And it almost felt like having a passport.
Yeah.
And that card was never more valued than at that moment. And I'm just wondering if this is going to be part of the new normal, at least for the short run, if not the long run.
Thank you for that. Let me add before this, we are going to obviously close here in a few minutes. We're going to send you a fair amount of information. We'll give it to Michael. He'll send it out, a number of resources to talk about. If you're still wanting to talk to communities, if you have groups you want to have this presented to, get a hold of us and we will provide this presentation. When we lead this, we work in small groups. We're very interactive and we listen to people. Regards to the vaccination card, if someone's lost it, we will let you know how to get it back. It's not always as easy as it sounds, but what I want you to think of is, if you have that vaccine card, that is now one of your personal precious documents. Photograph it, put it in your phone, share it with your partner, share it with your wife, family members, make sure you have it saved. It is very important to your life, and I think we're going to see more and more that's essential. I'll bet you there's going to be some resources and ways to get them replaced more easily in time, but right now, if you have that card, please protect it. It is important to you. And Michael, I know we're running short on time. Thank you. Grateful to have this opportunity here to speak. Our opportunity to speak about the vaccines is important, just to keep the conversation going. Since we've seen the impact it's had in our city, while the world sees a forced surge, we are not seeing it here in San Francisco. And that is a reflection of the people that have made this choice and taken the steps to become vaccinated here in our county.
And I want to give both you and Hafisa a pat on the back and a clap of congratulations, because I know that you've been working tirelessly going out into the community. We are but one program that you are supporting. And I know that your efforts and these sort of programs are helping and moving the dial and making a difference. So thank you to you both. And we look forward to continuing to collaborate with you as long as we are able. We will be taking a 1-week hiatus next week. And when we come back, we're on June the 3rd, we're going to be welcoming American Red Cross Northern California Coastal Region CEO Jennifer Adrio, who will be presenting on the pandemic's impact on the Red Cross, as well as the organization's role in COVID-19 response. You know, the Red Cross is one of our partners in disaster preparedness. And I can tell you, as long as I've been in this position, I always thought that what we were going to be talking about were wildfires or earthquakes. This has been a very different pandemic. So as we look at disaster preparation, response, and now hopefully heading into the recovery phase, there are going to be a lot of unknowns. And so we look forward to welcoming her. As we say thank you to you and Hafisa John, we also say thank you to Cynthia Zambucas, the San Francisco Interfaith Council's program and administrative associate. as well as to wonderful Elisa Carawala, who has been the producer, and Sharon Walton lead, and Nick Marino, and all of those who have helped to make not only this show, but this program, but past programs the success that they are. With that, we come to a close. We wish you a beautiful day and a lovely weekend coming up. And we look forward to seeing you back on June 3rd. God bless you and God keep you.